To Uganda, where health experts have linked the current wave of flu and cough in the country to COVID-19, but the health ministry said that they are finalizing the assessment to determine the actual driver. Reports say several families reported their loved ones being bedridden for days or losing their voices with the onset of intense cough, flu, and fever.
And also, children have failed to respond to medication which was previously effective against the three diseases or viruses. Now, some have had to be admitted to hospital and placed on oxygen machines. The rising cases of these airway diseases reported in towns and villages alike dovetail with news from Mulago National Referral Hospital that some two patients had presented with severe COVID illnesses over the past fortnight. We have journalist Darren Bartlett, who joins us from Kampala, Uganda. Good morning, Darren. Good to see you on a Tuesday morning. And thanks for joining us.
I think it's becoming a tradition to do a midweek review.
Yes, it is.
Sure, but it's okay. It's fine whenever it comes through.
Good to
how
see
are
you.
you? It's been a while.
Yes, good to see you, Darren. I've certainly missed seeing your face on TV, and I'm glad to be back and to have this conversation with you. So now let's talk about what's going on, Darren. There are fears that this might just be COVID rebranding itself, but the health ministry has said not to worry. What really is the position?
Well, it's been, I would say, about 2 months since people were experiencing flu-like viruses and cough, some similar characteristics that you would see in COVID. So it's been ongoing. However, by yesterday night in the evening, I should say at around 9 p.m., the Department of Infectious Diseases Control at the Ministry of Health, especially led by Dr. Patrick Tusime, came out and talked about this flu, and he ruled out. He said, he ruled out it being COVID because of how the flu is spreading, but he said there could be other flu-like diseases that are affecting people. And I can tell you for a fact that even where I am right now, we've experienced people having terrible headaches, flu, fevers, and hospitals have reported the same. As a matter of fact, over the weekend, there were different events that were happening of Rotary Club, and one specific one came out and warned the members who were together, gathering together, and they talked about warning the members who attended, say that they should go and test because it's likely that it could be COVID. But the Ministry of Health has put up a surveillance team that has been monitoring how it spreads and the effect it is having on people. And they've come out to believe that it could be one of those pneumonia, other viruses, but not COVID-19 because of how it's spreading. So the way the virus is showing in the characteristics of spread does not match as those of COVID-19. So they believe that it's other viral infections rather than COVID-19. But the public, of course, is a little bit worried and are not so much satisfied with that kind of explanation, given that people are having actually severe flu and to a point of being taken to hospitals, bedridden, oxygen, drips, and all these, other kind of medication. In Uganda, if you note that when COVID broke out, we had a drug that was manufactured locally called Covidex. People have consumed it, and it's actually out of stock. And they're trying to make more drugs. The owner, the manufacturer, is trying to make more to kind of satisfy the market. But the question of whether it's COVID or COVID-19 or not, at least has been ruled out by the Department of Infectious Diseases Control, the Ministry of Health.
Well, the World Health Organization just a couple of days ago had announced that COVID was no longer a world health problem. It was no longer a pandemic and all of that. So interesting to see that, there are these reports from Uganda. But let's talk about vaccination. How successful was the vaccination drive in Uganda? And what are the possibilities that this might even be something else and not COVID?
Historically, especially whenever there are heavy rains like we are experiencing today, and these heavy rains have been, in the season that we are not so used to. In fact, they started around January, where we expect it to be hot, and it's been raining from January to today. Usually it comes with quite a number of things, and pneumonia-like diseases usually show up in such seasons, and that's where we have a concern. And when we go back to records and look at the uptake of vaccines, Ugandans did not really, take all their vaccines. Most of them took half doses, and that could be a worry. According to the public, they feel like, because there are some people who didn't actually complete their doses, there's a possibility that they actually have the virus and their bodies are just fighting it. So it's not as deadly as it appeared in the first phase of COVID and all those other diseases. And when you look at also the records, we only had a number of people affected, about 170,000, with 620 dying. So the impact has not really been strong of COVID when it comes to Ugandans. And probably that's why it causes the laxity, and people believe like, no, the Ministry of Health believes that, no, this couldn't be COVID-19, especially with how it is spreading and the behavior of the few people that they have tested and sampled. And I believe, it's not. It could be any other virus like SARS, like, was it bird flu, and all those that showed up, from China. But yeah, they continue to take samples and analyze them and share the information with the World Health Organization for conclusions on that. But as of now, the surveillance team does not confirm anything to do with COVID-19.
All right. Thank you so much, Darren, for giving us these updates. I hope you're staying safe as well. Maybe it's time to whip out the mask again, just to be sure, until we can quite be certain what this is. And I hope you're not having any headaches as well.
I hate masks, but I will have no choice. They make me look around, so.
All right, Darren Bartlett, thank you for joining us all the way from Kampala, Uganda. Do stay safe, and we hope to hear better news as regards this situation in Uganda.
Welcome.